Hi, this is the second video on neck pain. Neck pain in the elderly. There are 35 intervertebral joints in the cervical spine. Problems with these joints are the most common cause of neck pain in the elderly. Inflammatory disorders such as rheumatoid arthritis and ankylosing spondylitis can be culprits. Rheumatoid arthritis can cause significant problems if it affects the upper cervical spine vertebrae, identified as C1 and C2. So if the patient has rheumatoid arthritis and neck pain, the physician should do imaging studies to confirm the stability of these vertebrae before surgery is scheduled or after a patient has experienced neck or head trauma from an accident, such as a motor vehicle accident. Other causes of cervical spine pain can be the result of the dysfunction of facet joints. A facet joint, as we discussed in the previous video, is a point where two or more bones join in the spine. Each vertebra has a pair of facet joints, one on the left and one on the right. Each joint is composed of a superior articular facet joint that faces up and an inferior facet joint that faces down. Facet joints are hinge-like joints that allow the flexion, extension, and torsion of the spine. These joints also interlock the vertebrae to make the spine more stable. Intervertebral disc problems. An intervertebral disc lies between vertebrae in the vertebral column. Each disc forms a joint to allow slight movement of the vertebrae in order to hold the vertebrae together and to function as a shock absorber for the spine. End impingement problems. This is the impingement of the nerves as they leave the spinal canal. This is commonly called a pinched nerve, and again occurs when a nerve in the neck is compressed or irritated where it branches away from the spinal cord. The physician will consider cervical spondylosis or disc degeneration. It is also called arthritis. Instability of C1 and C2, as discussed. Treatment includes symptomatic measures and cervical immobilization, usually beginning with a rigid cervical collar. Surgery may be needed to stabilize the spine. Polymyalgia rheumatica. Polymyalgia rheumatica, a type of arthritis, is a common cause of widespread aching and stiffness that affects adults over the age of 50. Because polymyalgia rheumatica does not often cause swollen joints, it may be hard to recognize initially. The average age when symptoms start is 70. The disease affects women somewhat more than men. It is more frequent in white men and women than non-whites. Metastatic cancer to the cervical spine from breast, lung, or prostate cancers. A Pancoast tumor. A Pancoast tumor is a type of lung cancer located at the top end of either the right or left lung. Ischemic heart disease and infection as a cause of neck pain in the elderly. Meningitis must also be considered. Even though it is more common in the young, it can still occur in the elderly. Meningitis is the inflammation or infection of a covering of the brain. Bleeds to the brain must also be considered, as they may also present with neck pain. Neck pain in children. In children, neck pain may be a manifestation of infection or inflammation. It may be the result of swollen tissue and swollen lymph nodes resulting from a throat infection. The physician will also consider pneumonia as a cause if the child has a high fever. Juvenile arthritis will be considered if the child persists with joint stiffness, especially in the morning, pain, swelling, and tenderness in the joints, and a persistent fever. But the physician will always consider meningitis as a possible cause. It is a cause of neck pain and must not be missed. Well, I think we will end our discussion of neck pain here. I hope this helps. Have a good day.